But now we are.
Yay. So we're going to record this session today. So if there's something you want to come back and look at, feel free to. We do put these on our website. So if you've missed any of our SOI live shows and you want to go back and watch those, check it out on our website. I'm sorry, I cannot see everyone right now because I'm in a different mode. So this is weird. I'm talking to a screen and can't see myself. So, welcome everybody. Thank you so much for spending some time with us today to learn about COVID-19. I am super excited to introduce you to our volunteer physician that's going to do this session for us today. Her name is Dr. Leah Ederer, and she has been a longtime volunteer with Special Olympics. Boy, Leah, I think since 2009 was your first year.
Yep.
And she has been doing, working mostly at health promotions. And she is our clinical director, one of two right now for health promotions. But she's also helped out at MedFest and just been around as a resource. So I'm going to turn it over to Leah, and hopefully between myself and Brittany, we can be good tech supports. Right now, everyone is on mute. But if you have a question, you can type it in the chat, or you could raise your hand or kind of wave in front of your video, and we can stop and talk about something if you're interested and have a question. And we'll also have time at the end for questions. So without further ado, I'd like to welcome Leah and just thank everybody again for being on the call.
Hi, so thanks guys for joining me, and I'm super excited to be sharing with you. I am sorry that you won't be able to do state games in a group form, but I really think that this is safest. But I wanted to take this time to discuss COVID with you and ways that you guys can stay safe and still stay healthy. Next slide. So what we're going to be doing today is kind of three different things. We're going to start off by talking about what COVID is and how we cannot get it, why we want to not get the coronavirus. If we do, what that process would look like, who do you tell, who do you go see, what the illness feels like, and then lastly, what we can do to stay healthy during this time. I'm going to start off by talking about what coronavirus is. So coronavirus is a virus, which means that it's super teeny tiny, and it's not living. But it can stay on surfaces for up to 72 hours. And the problem is that I can sneeze, and I get it on my hands, and then I touch the table, or I touch the door handle, and then somebody else comes in and touches the same door handle, and they can pick it up because it lives on these surfaces. A virus is what a common cold is. So people kind of get a runny nose. That can be a virus. It's different from a bacteria, which is like strep throat, where it stays so strep throat really just stays in your throat, and pneumonia really just stays in your lungs. But with a virus, it can go all over your body. And I don't know if you've heard some of the things about COVID, and we'll talk about it later, but you can kind of get diarrhea, and you can get a cough, and you get a fever. Sometimes there can be skin changes. So lots of different things can happen with a virus, where with a bacteria, typically it just stays in one place. So it'll affect your skin, it'll affect your throat. People kind of wonder what COVID-19 stands for. So that's what we're calling the disease. It's caused by the coronavirus, and COVID stands for corona. The vid part of it is virus, and the D is disease. So coronavirus disease from 2019. So this actually, the first known case of it was reported in December of 2019. So although we didn't really experience it until 2020 here in the United States, it was happening in other parts of the world in 2019. So that's why it's COVID-19 is what we call it. So if we know that this virus is out there, and you can, cough, and it can end up on, things that you touch, we want people to avoid going out. So we can't keep the virus from going away. We're going to do our best, but right now we don't have a vaccine, which would help to protect our body. Even though we hadn't gotten sick, it would help us to build antibodies to it. So if we did get sick, we could fight it off really quick. Because it's brand new, we've never seen this. Our body doesn't know how to fight it. So if we get sick, we can get really sick before our body starts to fight it off. So what everyone has recommended is to just stay home. Go out to the grocery store if you have to go once a week, but it's better to figure out who can shop for you. Is there someone who can, pick up milk and drop it off for you? Is there someone who can do that essential stuff for you? But also you're kind of stuck at home, and who can check on you? Who can come in and make sure that you're doing okay and that you don't need anything? There are some things that you can do though, right? You can go to your doctor if if you don't feel well. You can get outside and exercise. If you take care of someone, if you have a pet that you are caring for, or a dog, and the dog needs to go out, you certainly can do that. Our hope is that by doing that, we can limit the amount of people who get sick all at one time, because if everyone gets sick all at one time, we won't be able to care for them. So I don't know if you've heard the term kind of flattening the curve. You can see on the PowerPoint, if you can see the PowerPoint, that the red curve, if everyone gets sick at one time, there wouldn't be enough hospital beds to care for everyone, which is why we're trying to slow the curve down. So we had everybody stay home and not go to the movie theater and not do activities like Special Olympics, so that we didn't spread the virus around too quick and that too many people got sick. I'll have you, next slide, Missy. So my next slide has a couple of slides, a couple of videos that talks about why we're social distancing. But this one just has a list. We talked about, who can go food shopping for you? Who can you call to check on you if so say you do get sick. How are you going to let other people know? Is there somebody who calls you every day that you can say, hey, I don't feel well? What if your staff calls in and is sick? Can you make food for yourself? Or there's someone else that you can call? These are all good things to think about to prepare yourself kind of going forward. If you do have a concern, one of the things is that a lot of people they're having a lot of stress right now. So they're socially isolated. They're not going out and seeing their friends. So that kind of makes them sad. Or they're really nervous about, if they are going to get sick, and they're getting really scared about that. So on the other side has a list of people that you can call. So your care manager or the crisis hotline if you're really having some thoughts that are scaring you. And then the number 211 helps with different resources in your area. If you're having trouble, gosh, I haven't worked in a couple of weeks and I don't have enough money to buy food, they can help with resources for that. All right, Missy, I'll have you go to the next page and see if you can play the first video.
Brittany, I'll let you do that.
Oh, okay. Pull mine up here. 1 second, guys. I kind of gotta get my. Do you mind unsharing, Missy? There we go. All right.
Oh yeah, I can see everybody.
And sound. And we'll go to this one. Can you guys see the video?
Yep.
Mm-hmm.
And I'm gonna make it bigger. All right. Hopefully, give me some thumbs up if you can hear it. I don't even hear it on my end.
No.
Well, I can talk about what this screen is showing. So essentially, all the dots, but the blue dots are people who are not sick, and then the brown dots are people who are sick, and the pink dots are people who had the disease that are now better. So essentially, this is what happens if everybody is just moving around at one time. They're bumping into each other. They're sharing diseases. And then everybody ends up getting sick. So this is if we attempt to quarantine. So everybody can move around as they want, but all the sick people are going to stay in one place, and all the healthy people are staying on their own. But essentially, what happens is it's not possible, and some people get out, and then everybody, if they're still moving around, they get sick anyway. So it turns out everybody ends up getting sick before people can start to get better. So this one is, some people are going to move around, but some people are going to stay where they are. So this one, you can see that the people get sick much slower, and people are getting better before everybody gets sick. And that's kind of what we're attempting to do. And you can see how the curve at the top is really flattened. And this last one is kind of what we've done. We're like, nobody is moving around, just essential workers, just people who have to, deliver the mail and have people buy groceries. Everyone else is staying at home. And very few people are getting sick because those, same few dots that are moving around are kind of hitting the same people. And people are actually getting sick or getting better. They're turning pink before they get sick again. So you can see kind of this, it has everyone just moving around. There's a really high peak. And then if we try to not, the peak was, kind of flattened, but if we really don't move around at all, it was super flat at the end, which is what we were trying to do. People are always questioning, like, why are we doing all of this? And that's really our goal, so that if you do get sick, you're not moving around and touching other people. And then the second video here just kind of really, I think, is a good explanation of what social distancing is. And people say, well, I don't really understand. Can you show me? So the other one kind of said why it worked, and this is really how.
What is social distancing, and why do we need to do it? Social distancing basically means stay at home. And if you have to leave your house, stay at least 6 feet away from other people at all times. Why? Because social distancing helps stop the spread of bad germs that make people sick. What is 6 feet? Picture a door laying down at your feet. Make sure that door is always between you and others. Social distancing is so important right now that you're not going to school, a lot of adults aren't going to work, there's no eating inside restaurants, and all sports have been canceled. We can't be physically close to others right now, but we can still do stuff with them. Don't give people hugs or high fives, but do send notes and drawings. Don't go to other people's houses or have people in your house, but do wave when you see them. We won't always have to do social distancing, but all of us need to do it right now. You can be a hero by keeping everyone safe with social distancing. A message from Cincinnati Children's.
Did you want the third video? Sorry.
Not yet.
Not yet. I'll go ahead and share my screen again.
Okay.
All right. Do you see the PowerPoint again?
Yes.
Is it in a funky mode?
Right now it's just in normal edit mode.
I wonder how I get back to where we were.
I mean, it's fine.
Resume slideshow.
If you go to the slideshow tab, just under that, yeah. And then
I'm hitting the resume slideshow and it's not, there we go.
no, it's still in presenter mode with that next slide on the side, but.
How about that?
Yeah, perfect.
Woohoo! All right, so next slide.
All right, so in the video they talked about things that we can't do, right? So we want to avoid touching people, because if the virus is on our hands and then we go and we shake somebody else's hand, we're going to give them the virus. Same thing with high fives. So we don't want to be hugging, no handshakes, no high fives. Okay, Missy, you can advance. Right, Alex, only elbows. So this slide I really like. It talks about other things that you can do. So I am a doctor and I am working. I have my mask here, but we're doing virtual fist bumps. So we're not actually doing fist bumps, but we'll get really close when people have done a really good job. Like, hey, you quit smoking, that's great. You can wave, you can salute. My favorite is this. That is what Luke Skywalker does in Return of the Jedi. Star Wars is my favorite movie. So there's the elbow bump. I don't know if you're going to be doing the shoe shimmy and the hip bump, but a lot of times I will tell people just to keep their hands in their pocket, or if I am talking to someone, so I do some visits outside now because we don't want sick people to come into the clinic, and you'll see a picture of that later. But I always cross my arms so that I don't touch anybody. I don't kind of lean on the edge of their car. I always cross my arms so that I'm not touching things. So it's kind of a good thing if you need to do something with your hands, either cross your arms or stick them in your pocket. All right, next slide. So one of the things you can do is clean surfaces. So we know that coronavirus can live on hard surfaces like plastic for up to 72 hours. That is 3 days. So one of the important things to do is to clean them off. So high touch, we call them high touch surfaces. So desks and chairs, kind of the hands of your chairs that you use to push to stand up on, door handles, toilet seat handles. So I try every night we have, a little bleach bottle and a paper towel. We go around and we wipe the door handles down, the light switches, the arms of chairs, and things like that. One of the other things that you really think about is this. So smartphones. This is probably the #1 dirtiest thing, and you can kind of see that 25,000 bacteria per square inch. That's gross. And they say that a phone is dirtier than a toilet seat. Ew. And then we take it and we put it by our face. So a lot of the manufacturers, you can wipe it down or try to get a cover on I have a cover on the back of my phone that I can wipe down and take off and wash. So the next thing is about touching your face, and I just did it. I just scratched my nose. So I was going to have you guys kind of keep tabs of how many times I touch, if you can see me, how many times I touch my face during this presentation. And I know it's bad for you, and I try really hard, but you get a piece of hair, that's out of place, and you kind of touch that, and then your nose gets itchy, and you touch your nose, and you kind of get tired, and you sit and you do one of those things. We are touching our face 20 times in an hour. That means every couple of minutes I'm going to be touching my face, and I'm going to try not to, and you guys are still going to say at the end of the presentation that I touched my face 15 times, and I'm going to say, really? Gosh, now I have to go wash my hands. The concern is, yes, so washing your hands. And the next thing that we're going to talk about is washing your hands. And there's many, many steps to it. So you can't just be like, oh, here's the water, I'll put my hands in and be done. So you need soap. The soap has, the stuff that makes soap bubbly actually breaks down fat. And the virus, the coating that protects it, doesn't like that, and it'll actually burst when it touches soap. So you need water and soap to kill the virus. People kind of talk about how long you wash your hands. You can't just go deep and done. So I try to, A, B, C, D, E, F, G. You gotta wash the top in between the fingers. Rinse your hands, dry them, and then actually use a paper towel to turn it off. There's actually a really good video that we're going to show that's been put on by, that Special Olympics has created that I want you guys to see.
Hi, my name is Leah Ederer from Special Olympics Zimbabwe, and I'm a health messenger. Let me show you the 6 steps to effective hand washing here. First step, wet your hands. Second step, apply soap. Third step, wash your hands for 20 seconds. Don't forget to scrub between your fingers, under your nails, and the top of your hands. Step 4, rinse well with the tap running water. Step 5, dry your hands. Step 6, turn off water with paper towel.
So I think that that's really good and something that we could all practice. I actually have a little alarm on my watch, and every day it goes off and it says, wash your hands for 20 seconds, and then it times me how long that is. It's actually a really long time to be washing your hands. Okay. So the next thing, as I said, I've got my mask here. And I'm not going to leave it on because it's hard to hear me with it on. But we're doing that for a couple of reasons. So like I said, the virus is really, really tiny. So it can get through a mask, but you're not wearing the mask to protect you. You're actually wearing it to protect others. So I don't know if you guys can see this slide, but it says, if I have the disease, because I see people in the car and I've caught it accidentally, and I wear my mask and I sneeze, I am keeping the virus inside of my mask. If you sneeze, you can sneeze for 6 feet. I can sneeze the entire length of a door, which is why we say that you need to keep 6 feet apart. So if I sneeze and I have the virus and I don't have a mask on, I'm going to shoot the virus 6 feet. Then you can come along and catch it. If we're standing close together, there's kind of a less of a chance that I will catch it. But there's still a 70% chance if I don't have it and I'm wearing a mask that I will catch it. But if I have the disease and I'm wearing a mask and you don't have the disease and you don't have a mask, there's only a 5% chance that you will catch it. If we both have a mask on, then there's only a 1% chance. There's a 99% chance that we are going to be safe going out and doing things, which is why when you go out to the grocery store, if you go out to the post office, you really should be wearing a mask, and everybody else should be wearing a mask. and I don't want it to people to feel like I want it to be socially acceptable to do that. And I see some notes here about washing your hands. That's absolutely right. So once the outside of your mask is now dirty from all of these germs that you've kind of come in contact with, or you've sneezed in there. So washing your hands before and after you take on and off your mask is important. So kind of we talked about how to prevent getting the disease, and now we're going to talk about some of the symptoms if you have it. So this is a respiratory virus. So a lot of people do have a cough. So they have a cough, usually a dry cough. You're not usually coughing a whole lot up, or they feel really short of breath. I have seen a lot of people with kind of a chest tightness or a chest pain. The patients that I have seen that have had it have just kind of a chest tightness, not necessarily a cough, but they do have chest tightness. Other things that they have, people can have a low-grade temperature. That's one of the things that we're checking. So if you come into our clinic, we check people's temperatures before they come in. And I would say that this is, if you do have a temperature, then that means that there's an infection that's kind of going all the way through your body, but we don't always see that. Some people can have muscle aches. loss of taste or smell, sore throat, headache, or nausea, vomiting, and sometimes diarrhea have been shown to be part of the virus as well. My next slide shows people say, well, I've got a little bit of a runny nose because I have allergies. What is that? So I like this slide because it says some of the things that are just COVID, some of the things that are flu and the common cold. So if you really feel like if you can't breathe, that you have chest tightness, that we worry about is COVID. We don't see a ton of, chest tightness with the flu or with a cold. We do see lots of runny nose with the cold, and we don't see a ton of runny nose with COVID. You can, but not typically. Sneezing, lots of cold, lots of allergies have sneezing, but COVID doesn't typically have that. But dry cough and this kind of breathlessness is what we typically see with COVID. And go to the next slide. Okay. So, what if you do think that you're sick? One of the things that I want to kind of share with you guys is I don't want you to be afraid to go to the doctors. You'd be like, God, you just told me to stay home. Now you're saying to go to the doctor. So I want to make sure that there's a very clear message on that. So most doctors' offices, and certainly, my doctor's office here, we are doing everything that we can to keep people safe and separate. So all of our staff are wearing masks. We're wiping down our rooms with bleach after each patient. And we're checking everybody's temperature before they walk in the building. And we're also trying to keep anybody with symptoms outside, because the virus doesn't live as well outside and it can't spread as well. So we're trying our best to keep sick people away and separate. We're having people wait in their cars so that they don't, cough and put it on the countertop in the waiting room. They don't go to the bathroom and leave it on the door handle. We're having people kind of wait in their cars. If you do have to go to the doctor, if you think you have COVID symptoms, we're going to kind of talk about that. And if you have to go to the doctor because you have diabetes and your sugars are out of control, I want you to feel comfortable being able to go into the doctor's office as well. So if you do need to go to the doctor, there's a couple things that you should always bring, and they're kind of listed here, your medications, writing down any questions that you have or, symptoms that you have. You say, gosh, I'm afraid I'm going to get there and I'm going to get too nervous. So I'm going to write down that these are the things that I have, and you can think about it before you get there. You have to bring your insurance card, and then there's the About Me form. And I actually, on the next slide, have a picture of kind of what that looks like. And that's actually been put out by Special Olympics and does a really good job of kind of pictures of the symptoms and what they are, and then some information that about you and about how your doctor can communicate with you better. So if you guys have access to that, you should print that out, and maybe even something that you want to print out before you get sick. We were kind of talking about that list before, like how you can plan ahead and who's going to do your grocery shopping for you. Maybe having the About Me form already kind of filled out with some of this information about, who's my emergency contact and, where I live and my name and address and things like that.
And Leah, we can share, we'll do a follow-up email with everyone on this webinar today, and we'll share this form, and we'll also share the links to the resources that you list at the end.
Perfect. Okay. So kind of talked about what to expect. So we do have a tent, and I took a picture of that, but you can't really tell, and the next slide has a picture of me getting all geared up. So if you are sick, oftentimes people ask you to go to a different spot. Sometimes that's going to be a different part of the clinic. Sometimes it's going to be outside. They're going to where we're not letting anyone in our clinic who doesn't have an appointment. So you can't just stop by, because we want to make sure that we've talked to you and know if you have symptoms or not, to protect not just you, but other people. And again, everybody's going to wear a mask. That is hard if you do a lot of lip reading. They do have masks that have clear plastic in them so that you can still read lips if you need to, and you can ask for those.
It does look like we have a question from Scott. Scott, I'll go ahead and unmute you. Go ahead.
Is it better to wear a hazmat suit like some people do, or use a mask?
So the best thing to really do is to wash your hands and not touch your face. There's actually a really good video out there about wearing gloves. Okay, so I'm going to the grocery store and I'm wearing gloves, but once you touch the glove, so I have a water here, so I touch my water handle. I'm wearing my gloves, so that's okay, even if there's bacteria on here. But now that bacteria is on my gloves, and now I'm touching my face. You guys can mark that as one of the times I touch my face. So now I have that bacteria, even though I'm wearing gloves, that bacteria is now on my face. So even if you completely gowned up. One of the things about the face shield is that people can't touch their face because now they have this sheet in front of them. So that's actually probably helpful, but you don't need to necessarily, it actually doesn't live on clothing for very long. And if you kind of wear whatever you want and take your clothing off and wash it with soap, it should be fine. But I would be cautious about people wearing gloves and thinking that they're safe, but it's more just kind of not touching your face and washing your hands a lot. Scott, did that answer your question?
Yeah, I did.
It looks like we actually have another question from Michael. Michael, go ahead and unmute you. You might have to unmute on your end, Michael. Oop, shoot, I did it again. Okay, sorry, I won't touch. Michael, go ahead and unmute yourself again. There it goes.
So my question is, I watched all these things on YouTube. I heard about what my dentist did. My dentist did a face mask. What is the face mask? What do you wear the face mask for?
So kind of on one of the slides previously, so we're wearing a face mask so that we don't get, so when you talk, so sometimes people spit a little bit more when they talk, but you're kind of expelling to get the sound out, and the virus can come out on that and spread around to things that are close to me, my computer screen, my hands, my phone. When I talk on the phone, I can get germs on the front of my phone. So it's important to then kind of wash your hands. But if you have your mask on, you can prevent that spread of the germs that way. When you are in the dentist chair, you can't have a mask on, so it's really important for the dentist or the hygienist to help protect you.
Thank you.
And while we're at it, we have another question from Alex. Alex, go ahead, but I think you need to, there you go.
So once you leave the stores, you have to use hand sanitizer before you leave.
Yes. So a couple months ago, it was really hard to find hand sanitizer, and it just wasn't available. But now I see it much more in the grocery store, that they'll have hand sanitizer, or even kind of a spray bottle with wipes that you can wipe off the cart when you go in. You can use hand sanitizer when you go out. I have a bottle of hand sanitizer in my car. Even though washing your hands is better, hand sanitizer is really good if you don't have anything else.
Any other questions while we're kind of paused in the presentation? Michael, you got another one? Oh, I can't hear you. You got to unmute again.
I want to know about how they put the things inside your nose for the test.
Yeah. So actually, my next slide, maybe, Michael, I'll just have Missy move ahead as she, you've helped me, you've segued me, you've given me a what's next. So the nasal pharyngeal swab is what we call it. So the bacteria, the highest amount of bacteria lives at the the back of your throat. And if you can see that what we do with the swab is we go all the way back in. And I say, we're going to go in one side of your nose, we're going to tickle your brain, we're going to go on the other side of the nose and tickle your brain. So you have to go in both sides. And it has to stay there for a little bit. We actually twist it a little bit so that we can collect bacteria. What we don't want is to miss it, right? So you actually have the disease, but the part that I touched didn't have any bacteria on it, and now you think you don't have it, and you go and you share it with your friends and family, which we don't want. So it is not a super comfortable test. They're actually coming out with Exact Sciences. I don't know if you guys know this company. It's in Madison. They've come out with one where you can just do the front of your nose, which is a little bit more comfortable, but a lot of places are still doing this one that goes all the way back to the back of your nose.
Thank you.
Sure. So what if you have a cough, you don't feel good, you end up going to the doctor, they see you outside, they swab your nose, and it comes back and it shows that you do have the disease. So what they're going to ask you to do is, while you're waiting for your swab to come back, they're going to ask that you quarantine and not just social distance. So what that means is that you're really not allowed to leave your house. You're only supposed to use one bathroom in your house. If you have people that you live with, you're not supposed to eat food. You're not supposed to have dinner with them. And then when it comes back, they'll have you quarantine for 2 weeks. So if you come back positive, then you can't do those things. They're going to ask who you were in contact with. Like, yesterday, before you knew that you had the disease, who did you talk to? And then we have to test them and make sure that they don't have it. It's kind of public health are the people that make sure that we're kind of really trying to keep this contained. We'll contact them. Sometimes people are getting really sick with the virus. So what we typically see is that people get just a little bit sick and maybe they have a little bit of that chest tightness that we talked about. And then they come in, we find out that they have it. They actually get better for a day or two and they think that they're in the clear. And then on day 7, 8, or 9, they get really sick. They get really hypoxic, which means that they're not getting oxygen to their fingertips and their organs. And that's when they need to go into the hospital. Their lungs, the virus is starting to take over their lungs. So instead of breathing with this much lung, they're only breathing with this much lung. And it makes it really hard for them to breathe, and they need to go in the hospital at that point. So, if you do have the virus, you should really make sure that people are calling you every day to make sure when you say, I feel great on that, that day 6, when people start to feel good, that day 7, 8, 9, that you're not having trouble breathing again. Go ahead, Missy. So we kind of talked about this before about not being afraid to go and see your doctor. So we talked a little bit about flattening the curve, and if what we're trying to avoid is deaths from the COVID virus, but unfortunately it also means that people haven't been going to the doctors because, I just sprained my ankle a little bit and I'm not going to bother going to the doctor because I don't want to get that COVID. And then it turns out that they actually fractured their ankle and they didn't get a cast when they should have, and now they've got some pain from that. So, and like we talked about, kind of, really having kind of some scared thoughts about, gosh, am I going to get the disease? And I'm afraid to go. And what does that mean? And I can't. And then your brain just kind of gets crazy. So, I just want this slide is to remind me to tell you to not be afraid to come in, because this virus is affecting people in lots of different ways. And we are here for you, whether you have the virus, whether you have concerns about the virus, whether you have something else, whether your diabetes is getting out of control, but not to be afraid to kind of come in and talk to us. And if not, most offices are doing telehealth visits now. So that means that we can do just like we're doing now. I can see you on the screen. You can show me a rash that you have. We can talk about, your blood pressure. Whatever you need to do, we can do it however you feel comfortable. Just don't be afraid to contact us. This is the same slide. So just that we're taking precautions and keeping healthy people and not healthy people separate. So the next part of my slide, so we talked about how to not get coronavirus, And then if you do get coronavirus, what do you do? And then kind of the last part of my slide is just ways for you to stay healthy and to stay strong during this time, because again, it's really tough. We're not seeing our friends. We're not, going to camp. We're not doing Special Olympics. We're not doing all the fun things that we typically do over the summer. So I really liked this presentation. This was something, or this picture that I try to do. So every day I try to do, to do one thing that makes me happy. So number one, we got to stay connected. Even though we're not seeing people, like it said in the video, we're going to send them pictures. We're going to draw them a picture. We're going to call them on the phone. We're going to do Zoom meetings. We're going to have a Zoom lunch, and chat with our friends. Number two, getting outside, and actually talk about that a little bit later, and all the good benefits of exercise and getting outside. Number three, staying away from bad news. If you listen to the news, it talks about all of the stuff that's going on, and sometimes that's not super healthy. So kind of finding out what you need to do, but staying away from all of the things that make you sad. Number four, trying a new hobby, whether that's I'm going to sew, or I'm going to learn how to play cards, or I'm going to start knitting, or I'm going to do crossword puzzles, trying something new. And then lastly, just kind of being kind to yourself. And if you looked at the picture, it kind of talks about I'm going to shower, because sometimes I'm not going anywhere, so why should I shower? I'm just going to wear the same clothes, to bed and after I wake up. So, and I have to admit that I did not put makeup on for months, but I put it on for you guys, and I curled my hair, which you guys should feel really good, because I've been wearing, you saw me, I've been wearing a lot of scrubs, and I've had my hair back in a ponytail a lot. But, I'm still showering every day, and I'm making sure I drink a lot of water. We planted a garden. That's one of the things that, it says on the list, 10 something growing or living, taking care of your pets. They really need you. It's good to feel needed. Cleaning, one thing, I cleaned my refrigerator. That really needed it. And just doing things that make you happy. I'm gonna read. I'm gonna sit down and I'm gonna read. I'm going to go for a walk. That kind of thing. All right, next slide. These are ways to keep your mind strong. Actually, I borrowed this from Strong Minds. And I think they did a talk, or they're going to be doing a talk coming up. If you guys haven't listened to it, I think that you should try to make an effort to do that. So number one, kind of connect with others. We talked about that. Getting 8 hours of sleep. Oh gosh, I don't have anything to do tomorrow. I'm just going to stay up and watch another episode of Tiger King. Is that the thing that everybody's watching now? I don't know. I haven't seen it, but it's important to really get enough sleep. No electronics within an hour of going to bed. The light that comes out of the screen is a blue light, and it actually tricks your mind into thinking that it's daylight instead of nighttime, and it makes it harder to fall asleep. No caffeine before going to bed. Actually, if you wear socks to bed, it helps to regulate your body temperature. It makes you sleep better. So don't look at your phone while you're sitting in bed, and wear socks are some good suggestions. Staying active, eating good foods. Half of your plate should be fruits and vegetables. So, think about your favorite fruit and vegetable is, and make sure that you have it in the house. Make sure that if somebody's going grocery shopping for you, that they buy it for you. Like, I like apples and carrots. Those happen to be the pictures that are on there. I'm going to make sure that I have those with me. So whenever I want a snack, I have something that's good to do. Strong mind strategies, deep breathing. When you get stressed out, just taking a moment to do that really helps to center you and can prevent your mind from going crazy. And then lastly, asking for help. And there's lots of people out there who love you and care for you and would be happy to reach out and help. Staying connected, we kind of talked about the different steps. So there's lots of ways that you can do that through social media, through sending letters, through phone calls. One of the good things I think about this pandemic is that it really has allowed people to become much more connected through screens and Zoom and meetings like that. So I think good for everybody for kind of stepping up to that. This was the slide I was kind of talking about exercise and what it does. So exercising releases endorphins, which are kind of things in your brain that make you feel good. So when you're exercising, sometimes it's really hard, but afterwards you feel really good about what you did for yourself and about the good hormones that it releases. And being outside, the sunshine releases serotonin, which is it kind of goes in through your eyes and tricks a part of your brain and makes you make more serotonin, which is what makes you happy. Also helps you to sleep, because serotonin and the sleep hormone are very similar. You just don't want to do it right before you go to bed. All right. Next slide. Sleeping tips. Actually, we just talked about that. The only thing I didn't talk on is you shouldn't do anything in your bed other than sleep. So don't watch TV in bed, don't do crosswords in bed, don't look at your phone in bed, because then you start to associate your bed with all these fun activities and you lay down and you're like, okay, what's going to happen next on TV? Instead of when you're lying down and in bed, that's sleep time. So try to just sleep in your bed. Right. So we talked quite a bit, and actually we've been on for almost an hour. I want to leave some time at the end, but I made a list of kind of some good resources that Missy said that she would send out to you guys every after the visit, so that you can click on them to get more information, and some of the places that I gathered the information from as well. So are there any kind of questions now? I know we did some during the visit, but anybody want to ask questions or raise their hand or say hi or tell me how many times I touched my face?
Nothing's really come through the chat. I've been kind of keeping an eye on it, just people chit-chatting about some of the things that they do. No questions that I saw, though. Kyle did mention, and maybe Kyle, do you want to share your experience? He actually got tested. He's negative, but maybe share how that went.
Yeah.
And then Andrew has a question too.
Okay. Go ahead, Kyle.
Oh, I got both me and my mom got tested at the Alliant Energy Center at Madison, and they stuck the thing up our nose, and some female lady did it on my side, and I had it done, and the newsletter said it was going to be really painful, but it wasn't. So
that's good.
Yeah, it didn't hurt at all that bad, and I tried to blow my nose and I couldn't get anything out. So and I got a letter I got to present to go back to rookies when they open up, which I don't know when I'm going to be going back to work. So
yeah, well, I'm glad it was a good experience and that you're negative.
Yeah, so, that's good.
That went well.
Mm-hmm. Yeah.
Okay. And Andrew, you had a question?
How did I get tested for coronavirus?
So, Andrew, where do you live?
In Waukesha.
Waukesha. So there are some places that are having kind of drive-through testing, like at the Alliant Energy Center. I know they have one in Baraboo and they have one in Reedsburg, because that's the area that I am from. If you call your doctor's office, they should be able to tell you, to direct you on how to go. So there are some, if people have symptoms like I have a cough and I'm worried that I have it, there are places that you go, and then they should also have a place where if you, I'm just worried my neighbor has it, I don't have any symptoms, but I want to get tested, they can tell you where to go for that as well.
Yep.
And then it looks like Scott also has a question. Scott, go ahead.
Great. Oh yeah. When you get tested, do you always have to get a shot? I hate getting chips. Like,
So that's the nice thing about this. There's no shots. The worst part is kind of getting that thing in the nose, but there's no shots for this.
and I know how many times you touched your face in the whole video. Like, whole ball.
I'm sorry, Scott, I didn't hear that. Can you say it again?
I said, I know how many times you touched your face.
Oh, how many?
2.
No, that's not, I mean, it's not great, but that's not as bad as I thought it would be.
Jennifer, you have a question?
And you
I think you might have to unmute yourself. There you
When
go.
is this thing be done?
When's the coronavirus going to be done? She wants to know.
That's a great question.
That is a really good question, and I wish that I knew. I spend my entire day telling people I don't know. I don't know what the summer is going to look like. I don't know when people are going to be able to get their surgeries that they have scheduled. I will say that here in Wisconsin, we have done a really good job of flattening the curve. Not a lot of people have gotten the virus, which means that there's still a lot of people out there to catch it. But we're doing a really good job of making that curve really slow and hoping that a lot of people will have become immune to it before that they can spread it on. I will say that we have not seen that many people. We did not see the number of people that we thought of that had it. So things are starting to open up a little bit now. And maybe we'll see more. So we just kind of have to wait and see what the summer looks like. But I do not think that people should be going out and going to restaurants and bars just yet.
Loved it. Evil 5.
And looks like Michael, do you have a question? You might have to unmute on your end.
So the question is, I talked to my friend Lenny. We will do Rainbow Day Camp, and what is good masks to bring to Rainbow Day Camp in Milwaukee?
Did you say what kind of mask to bring?
Yeah.
The best mask is the mask that you're going to keep on your face. So I see a lot of people kind of doing one of these things, and the mask isn't really covering their nose and mouth. That's not gonna work. If you have a mask and you don't like the way that it feels around your ears and you're constantly adjusting it or fiddling with the nose piece, then you're touching your face a lot more than you would if you didn't have a mask on. The research shows that that any mask is going to be good. So as long as you cover your face, that's fine. So if you have a cloth mask, or you have a surgical mask, or you have a mask from cutting wood, all of those are okay.
Thank you. You're doing a great
Jennifer's
job.
doing a good job demonstrating there. She had her mask on.
All that.
Okay, talk to you later. Like Scott might have another question. Go ahead, Scott.
Is there a terrible, no, okay, that's a bad word. Is there like such a thing as a bad mask to wear?
I think that's a little bit of a difficult question. So if you wear the same mask over and over and over and over again without washing it, that is probably a bad mask. If you have a mask and it gets dirty, you need to either wash it or get a new one. But other than that, there really isn't a bad mask.
Okay. So what's the best mask to like use? Like carpenter mask, shield mask, stuff like that.
So like I said, it's the whatever mask that you will keep on and feels most comfortable for you. So I have several different masks. My sister-in-law made this one for me. I like it because it has a little thing that goes over my nose. I also have one that fits really nicely over my ears. Those are my two favorites. I have some that are that pull on my ears a little bit. I don't like those as much, and I find that I fiddle with them more. So a mask that fits on you, that you can see around, that you don't have to constantly be moving because it's getting into your eyes. The mask that fits you is the best, whether it's a paper mask or a cloth mask.
Okay, thank you.
Those are great questions.
Got one in the chat. How do you handle your mask when you take it off? Do you hang it, fold it a certain way?
So, so what I do is I try not to, I've been touching it a lot because I've been showing examples, but what I typically do is you're supposed to fold it, and then I pull it off this way, off my neck, trying not to touch it. If I'm in my car, I then kind of hang it in my car so it doesn't touch anything. If you're going to leave it for a while, you're supposed to fold it so that the dirty part is really stuck on the inside, and then you put it in a paper bag. So I have my paper bag is attached to my bulletin board here, and then I stick it in my bag. I have my my glasses in there as well, because when I'm seeing patients, I wear safety goggles too. It makes me hard to see the screen sometime, but.
Anyone else have anything? I don't know if you wanted, I know we're right at 2 o'clock, but if you want to just touch briefly on the antibody test and if that's recommended or not, or.
Yeah, thanks, Brittany. So we have been doing antibody testing at the clinic for just about the last 2 weeks, because up until that point, there really wasn't a very good test. We were getting a lot of false positives back. But the test that really, the Abbott test that people are using now is about 96% sensitive. I will say that I'm actually surprised that we are not seeing as many people with the antibodies as we thought that we would. So for the last 2 weeks, we've had people come in, and these are people that were sick. You know, I was really sick in March, I was really sick in February, and I really think that I had it, and they're not. We actually haven't had any antibody tests positive. So all these people that think that they were sick with the COVID really weren't. But if you do get an antibody test and it's positive, we don't really know, just because the virus is so new, we're not sure that that means that you are protected. There are some reports that people can get sick again. So we're not saying, hey, I had the virus before and I can't get sick again, so I'm going to have a party. And what that means is that all the people that you invite to your party, they can actually infect each other, and you might get sick again. So even if you do the antibody test, it shouldn't change the way that you are living. You should still try to wear a mask when you go out and wash your hands a lot, and try not to leave the house unless you need to. So I don't really know if the antibody test at this point is super beneficial, because I don't think that it should change what we do.
Well, thank you, Dr. Leah, for being here today and sharing all the COVID knowledge you have. I do want to again tell everybody on the call, I'm going to send a follow-up email, or Brittany or I, one of us will, with the links on that last slide with resources, and then we'll also share the document from Special Olympics International that they created, just on things you can think about and questions you could answer before you go into the doctor, just to help you be ready for your appointment. So I'm going to plug a couple more things. We do have a 4 o'clock show today. And it's a fitness, so becoming ready to work out. We do have our opening, it's not our opening, it's our celebration ceremony tonight at 7 on Facebook. And then tomorrow, the time is at 4:30, Don? Yes, 4:30 is our sports, kind of sports talk show. So, yep, SOI Live. And we hope to see you on some more shows either today or tomorrow. Thanks, guys.
Bye. Stay safe.
Leah, are you able just to hang on a sec? Don wanted to talk to you. Okay.
There's a nice comment from Ruthie. She's with Special Olympics North America. She said, great job, Brittany, Leah, and Missy on the webinar. So just want to make sure you saw that. Hi, guys.
I removed people.
Don't they?
So Leah, have you met Don before? He is he's our VP of Sports and Health.
Oh,
Hello.
So he's our boss.
Boss man.
Yeah, when you were going through all the different ways to say hello, I said that they can, to both of them, they can bow now when they come in my office.
There's also the middle finger hello. Even over my shirt, but you couldn't see it. It's down too low.
I've got my Minnesota one on.
Trader.
I have nothing.
Yeah. Hey,
Yeah, that was great.
I wanted to ask you, we've been working on a kind of return to play plan.
Did you stop recording?
Oh. You got the middle finger comment. We probably should
to edit that.